So like find mentors first and foremost, different career paths, have those informational interviews, and recognize that your pathway to public health, there's no central line to it. You're going to run into pivots. You're going to run into circles, or like maybe you'll run into briefly into a wall, but then you'll kind of avoid it, and recognize that there's no one singular path. Whether you want to end up as an exec director, or maybe you want to end up in running a government agency, or maybe you'll end up working as a caseworker, or you end up teaching in academia. I mean, there's so many different fields that you could go into. You could go into academia, you could go into nonprofit, you could go into government, you could even go into private sector. And sometimes you have to try them all, and maybe you'll like one more than the other, and then you'll find your passion from there. But just know that you do have time, and don't be afraid to try it.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey friends, welcome to another episode of Public Health Careers. In today's episode, you'll hear more about how this person's work partnering with invisible communities of sex workers and immigrant farm workers, and what you all can learn from this around community engagement and really building trust. How working with immigrant farm workers led her down the path to wanting to pursue immigration law, and just understanding how important that was for immigrant farm workers' health and well-being. Being a city council person, and why it is important to have more public health persons in these political leadership roles. And I believe this is the first having a city council person or former city council person on the podcast. And then the last thing is the organizational growth of the statewide nonprofit Micronesian Islander Community and her role as executive director, and really her role from going from secretary to board chair to executive director, and what that's really meant for the organization and the deep work that they're able to do. If you enjoyed today's content, all I ask is that you hit that subscribe button, leave a review, and share it with a friend or someone who gets some value from it. Hopefully that's both of the same people. This is really the best way to show support to this show and help other people better learn, navigate, and transform their public health careers. And definitely doesn't cost you anything. So be sure to subscribe, to leave a review, and share it with someone. I greatly, greatly appreciate that. Okay, now enjoy the show.
Hi, everybody. My name is Jackie Leung. I am an assistant professor of public health at Linfield University. I am also the executive director of the Micronesian Islander Community, and you are listening to Public Health Careers.
Today, we have someone with an interest in global health and public health, particularly healthcare access, utilization, and policy research. She has a background in human rights and immigration law and nonprofit leadership. She conferred a Bachelor's of English at California State University, Los Angeles, then got her Master's in Community and Behavioral Health at the University of Iowa. She then went on to get her JD or Juris Doctor in Law at Willamette University College of Law. She currently works as the Executive Director of the statewide nonprofit Micronesian Islander Community and is an Assistant Professor at Linfield University. We have Jackie Leung, JD, MS. Welcome to the show.
Thank you for having me.
Truly is my pleasure. Looking forward to hearing more about your perspectives. I don't get to talk to people in Oregon, I feel like, often, so I'm looking forward to this.
Me too.
Good. So before we get into anything, how do you identify, and then tell us a little about your personal background?
Yeah, that's always a loaded question when you ask about a person's identity, right? Because there's so many intersections there. So like I said, my name is Jackie. I'm a female. I live here in Oregon, Salem, Oregon specifically, so in the state capital. I am a mother, first and foremost. I have 4 kids. My oldest is going to be 15 next month, and my youngest is 4. So I'm busy running around as a parent. I'm also busy running around teaching, as well as running a nonprofit and trying to get work done within the community. I specifically identify as a Chinese American. I'm born and raised specifically in the California area, and lived in California for almost half my life before I moved to Iowa. And then from Iowa, now since then, I've lived in Oregon.
Yeah, well, thank you for sharing that. And yes, it definitely is a loaded question, and it could go in so many different directions. But I appreciate like you identifying the way that you do and sharing that with us. And I look forward to hearing how those perspectives have really like shaped your public health journey and the work that you do.
Definitely.
Before we get into anything, can you talk more about the importance of human rights and specifically immigration law?
So how I ended up getting involved with both law and public health, it actually stemmed from my initial interest in pursuing public health. When I was pursuing my master's in science at the University of Iowa, the group I ended up working a lot with were migrant farm workers from Mexican migrant farm workers who came specifically during the summer months to do farm work specifically for corn, as well corn harvesting and watermelons. And through my work in providing STI, STD, HIV testing with the community, one of the conversations that came up constantly at that time was immigration law related questions. And at that time, when I was pursuing my public health degree, I actually was pre-med. And I decided that, based on those conversations, I wanted to go and get my law degree instead because it felt like that seemed to be like a more pressing issue. So I finished my degree, continued to work within the community, ended up applying for law school, and that brought me here to Oregon, where I attended Willamette University for my law degree. And during my third year, it's normally a 3-year program, but I took 4 years. During my third year of the program, I got accepted into a legal clinic that centered on human rights. And I had the unique opportunity my first year in this clinic to be able to focus on both, they did a combination of like immigration law related things and under supervision of an attorney, helping people apply for asylum. But in addition to that, I had an opportunity to work together within a group to create for the United Nations Women's Committee that was coming to visit an update in terms of how well Oregon was doing for women's rights. And it was very eye-opening to be able to pull that information together to see what Oregon was doing to support women and girls and making sure that they had the care and support that they needed across all platforms. And then my interest in immigration law continued from there, and I graduated in 2016, and I didn't pass the bar, so I don't have a law license, unfortunately, so I can't actively practice law. But I'm okay with that because I've still been able to build connections within the community, still people who ask me legal questions, but I'm able to refer them to other attorneys who practice in that field. It wasn't mentioned, but I'm also now decided to go back and finish my PhD in public health and public health, specifically global health, with minors in ethnic study as well as in food and culture and social justice.
All right, just writing everything down there so I can refer back to it when it makes sense as well. I appreciate you sharing that, and that is an illuminating journey, and I'm looking forward to hear more in detail on like how those things came up and your experiences throughout that. But I like the part of like you beginning to work with farm workers and then realizing that a lot of the questions that they were asking were around immigration law, and then from that decided to pivot more from like public health into law to kind of best serve the need that you were seeing at that point in time, which has taken you in a lot of different ways. And then I'm also excited to hear more about the why you are pursuing a PhD in public health and how all that fits into the future and the work that you're doing. So I appreciate you sharing that. Your background encompasses public health, law, nonprofit leadership. How have these diverse experiences shaped your approach to promoting health equity?
It comes down to social justice, and a lot of that I got really in depth in even before I went for my master's degree. When I was still pursuing my bachelor's back at Cal State University, Los Angeles, eons ago, I had an opportunity to do some volunteer work, specifically with a few agencies that worked on HIV, STIs, and I went and did a lot of outreach with locations. We went to talk to sex workers as well as to we talked primarily to the madams, but it was like more going into those areas and having those conversations, asking, we're not questioning if they're doing these things, but more handing out information about here's areas we could go get tested. Here are some condoms. Here are other resources. Please share it with the people that work there. And it was a very unique, eye-opening experience because it allowed me to really engage with members of the community, even with pockets of community that you normally don't associate with. I guess we could add with the little astrages, because like these are communities where they're present and they're usually hidden, and it was a unique way for me to get to know this groups of individuals, as well as provide support in the best way possible. And then from there, my interest and passion towards providing ongoing casework, social work, health work continued. And that's where, when I went for my master's degree, I continued to do work specifically with migrant farm workers. And the way I was able to get involved with the migrant farm worker community was because the College of Public Health at that time had a partnership with the College of Medicine, both at the University of Iowa. And they had mobile health clinics. And from there, I was able to connect with the mobile health clinic and actually expand the communities that the mobile clinic was serving. Because at the time, I think they were only servicing, I forget if it was 2 or 3 communities, and we ended up expanding it to an additional 4th one. And that's where I was able to use my public health side and be able to provide more health education, build their program evaluation, and even creating needs assessments and showcasing what needs to be done to make sure that what services were provided to the communities, whether it was farm workers, whether it was Spanish-speaking immigrants, or whether it was a Somali community, that the services were provided to the best of our ability. And then it continued when I came out here to Oregon. And like I said, when I first started working at the immigration rights clinic, I realized I wanted to do something outside of just being in the school system, because I was a little tired of just being in the classroom. I'm more of the kind of person that has to be learning hands-on, not just reading the books. And I searched, and I found that in the city of Salem, they had a human rights commission. And around that time, I applied for the commission, and I was accepted, and I started doing work within the commission. And that's where I started doing a little bit of government work on a volunteer basis as part of a commission. And I did that for 2 years. And around that time, I actually applied to run for office. And so I ran for a city councilor position in the city. I won. And for 4 years, I served as a city councilor. And I'm still involved in a combination of different fields. The government side, I do more of the policy and advocacy piece, specifically if it's bills related to the Micronesian or Pacific Islander communities. I still focus also on some legal related things, more getting resources to community members. And as for my nonprofit work, I've been running my nonprofit now officially as executive director for 3 years, but started initially as a volunteer about 11 years ago as the secretary.
The first thing that I wanted to highlight there is, like, I'm sorry that I missed that you were a city council member for 4 years. And I would have definitely put that in the bio, because that's awesome. And I think that's a perspective I haven't had on the podcast as yet. But people that are very, very fundamental to the decisions that happen in community, and many times are the people that are disconnected from community. So I'm glad that someone, at least with a public health perspective, and this is just my experience with the city council members and in the communities that I work with, they are they have a power leverage, and many times they don't want to engage with the community, because then it just creates more processes for them to work through and create like the solutions. But that's neither here nor there, nor that part of that conversation. But we'll talk a little bit more about your city council membership later on. But I appreciate you sharing that, and you shared a lot there. But I will get into that as we progress in the episode. Okay, so what does public health mean to you?
So, I mean, I could give you the textbook language, but I mean, I also agree with it, though, because when we think about public health, there's several different key pieces to it, right? We're focused on how it's both an art, and then we're also focused on the science aspect. So we're talking about the science piece, we're talking about data, big numbers that we had to pull in to actually get the money. But then the art piece comes in because we're sharing those stories, those experiences, and the impact that it has on community. It's about health promotion, it's about disease prevention, it's about ensuring the best health for everybody so that they could be the best that they can be.
No, absolutely. Couldn't have said it better. And the definition that is out there does amplify. Like once you understand those concepts and the frameworks there, it is very encompassing of all the things. Okay, so you started off your collegiate journey not in public health, but you got a bachelor's in English at California State University, Los Angeles. Tell us about that thought process.
Oh gosh, that's when I talk about it, it's a little silly actually. At that time, there was no actual public health major like there is today, especially at the bachelor's level. They had a health science program, and so when I actually started at Cal State, I was a health science major, and I changed my major for the most silliest of reasons. I remember it was during orientation. It was a very hot day. And we already spent half the day walking on campus, and we were at our final meeting, and there was no air conditioner. It was just really hot in the room. And I'm listening to the coordinator speak, and it's only like 4 students, including me, listening to this coordinator. Next thing you know, I fall asleep. And I woke up probably like a few minutes later, and she's just staring at me. I felt so embarrassed that I decided, I can't do this.
No.
And I switched it. It's of all reasons. Like it had nothing to do even with any other reason than I felt so embarrassed. But then I thought, what other major can I pursue? And I thought, I loved English when I was in high school. Why not? And because I was at that time really interested in going into medical school, you don't need to have a science background to go into medical school. You still don't. And that's why I thought, it doesn't matter. I could do this, still do my prereqs, and still get in. I kind of regret that to this day because it could have jump-started my career in public health a lot sooner, but it is what it is.
Yeah, well, thank you for sharing that. Sorry that you fell asleep and you felt the need to drop the program. But I think it also highlights the point of, like, regardless of that and changing to English major, you still made it back to public health. And there are just so many ways to get to public health, regardless of if your bachelor's is related to public health, as well as maybe just getting those electives and those experiences that are more focused on public health, as well as, I guess, thinking about it, they say very same way like medical school doesn't need traditional applicants, public health schools don't need traditional applicants. And I think the intersectional experiences and knowledge that comes into public health makes it a better field. So sorry that had to happen, but you are here today, so I'm glad to see that. And did you have any big takeaways during your undergrad experience?
From what I can remember, it was just being involved, getting out there. That's something that I still continue to do, even though, I'm farther removed from my bachelor degree days. It's important to know, like, if you're more into like crunching numbers, or if you're more into like the policy piece, or if you're more into community related work, and try to hone in on like those key areas that brings you the most joy. And you could explore all of them, but then you have to also do a delicate balance, because I love all those things. And I've had to learn over time that you can't do everything even though you want to, and be everywhere even though you want to be. So that's where I still do some of the policy work. It's where I still do community outreach. And that's where I, still do the data numbers, but I also recognize that I do a little bit of number of data, but it's okay to work with somebody else who's more into the numbers, who could dig out what you need versus you trying to figure it out yourself.
Absolutely, the who, not how, and understanding
Right.
that you have expertise and other people have expertise and enjoy doing certain things that you mightn't be able to do at the same capacity as them, and really being able to delegate that work out, or just thinking about how to partner with people. Very, very important, I think, for life, for business, for everything in between.
Yeah, especially in the field of public health, and like how it's continuing to shift. I mean, when I was going for my master's, one of the big pushes was like, you only could work in these fields. But public health has expanded to the point where you could actually use a degree in so many different areas. It's not just you only could work at a local public health agency, or you could only work at a clinic, or you could only work for a nonprofit. I mean, you could do government, you could do nonprofit, you could do all those things. And It's just a matter of like finding where you fit and where you feel best fits not only your personality, but also your skill set and where you see yourself growing.
Absolutely, absolutely. And I think the pandemic especially has pushed public health into new industries that you haven't traditionally seen them or haven't seen them highlighted in, especially in like private industries. And I think it is the value of the skill set and really thinking about how can you develop the skill sets that are making you the strongest candidate for whatever type of area of work that you're trying to do, whether that is traditional local public health or going into Apple or Amazon or something like that. So you got your master's degree in community and behavioral health at University of Iowa. You said that you were thinking about pursuing a medical degree. How did you end up pursuing this degree, or like what was that thought process?
Well, initially when I was looking at medical school, I was still looking at that when I was in my master's program. But then during my ongoing work, specifically with the migrant farm worker community, like one of the things that came up during those conversations, besides getting medical screenings by the medical students, as well as a physician assistant and the nurse assistant who handled the clients or patients, they asked me, like, who can we talk to about legal related things? And that's where I tried to get connected to the law school at the University of Iowa, but it didn't quite work out the way I wanted it to. But then like there was a lot of questions that related to like their visas, their work visas, and what it meant if they stayed beyond it. And actually because I was doing the master's of science program, you have to do a thesis versus a practicum. And so my thesis ended up being it was on healthcare access and utilization among migrant farm workers. And during some of those conversations, like some of them talked about how that even though they were here on the work visa, once their visa is over, they either have to go home, or if they choose to overstay, then they can't stay here. They have to go someplace else. So some talked about how there was other family members who initially came with the work visa, but then when it was over, instead of going home, they would go to another state and then become undocumented. But then for them, it was more important to continue working here versus being sent back home because they needed the jobs. They needed the money to be able to send back home to their families.
Yes, the migrant farm worker system is very broken and it is very exploitative and oppressive in many, many ways. And I think we need to figure out better ways to support that community that many times is like getting most of the food for most of us out here, and we just don't think about it. So they're very, very important to us and our livelihoods. And it's very, very sad because I work with groups that work with migrant farm workers, and I've heard many stories, and I can imagine from your experiences what that has looked like. And I guess going along this migrant farm worker theme here, which I think is what kind of carried you away from medical school and thinking about how can I like get more of this work experience. You shared a little bit earlier that when you were in your master's program, you partnered with the College of Medicine, who were doing mobile clinics, and you worked with them to expand those mobile clinics. So tell us about how you got involved in that, and then how you really like worked to improve and expand that program. And I think you also mentioned that you did some evaluation work to support them there as well.
Yes. So when I was still in my master's program, the College of Medicine, the College of Public Health were just buildings right next door to each other, and a lot of public health students took some of the medical courses, but a lot of the medical students and the physician assistants, even their dental students and everything, would take public health classes. And through some of the contacts and connections I built from the other programs, I learned that there was a mobile health clinic, and the mobile health clinic would schedule, I believe it was once a month, I can't remember what semester or quarter, every term, medical screenings. And so I first went to one of their screenings just to see what it was like. And I realized that they didn't have much of a public health presence. Like they would have a table that had resources there that they might have gotten from other nonprofits or from the hospital to hand out to community, but no one was stationed at the table to distribute these resources. It'd be like, here it is, take one, get one free kind of deal, and then take it to and share it with other people. And when I brought that up during one of the mobile clinic meetings, they asked if I was interested in expanding their public health program because they didn't really have one. And so I took a look at a lot of the different resources that were available, and I realized that we just need some people who are comfortable generalists who'd be willing to hand out resources, or if there was a specialty area that they would be able to work on. And because my main focus was on HIV, STI testing, I ended up then partnering with the Johnson County Public Health, and I was able to provide HIV testing through their clinic at the mobile clinics, as well as having condoms available to hand out and just talking about STIs in general. Sometimes there was interest in that, but the main things that people tended to make a beeline for was on chronic diseases, specifically diabetes, as well as high blood pressure and high cholesterol. And so, and then we ended up adding a few additional things that kind of came up more from conversations based on the work environment, because we're talking about migrant farm workers. They work outdoors in the heat all day, every day, from right when the sun starts to rise all the way until it sets. In the summer months, that could be 12 to 15 hours that they're working until they're done. And so we ended up adding additional resources about sun safety, and how we even were able to get some sunscreen. For example, we talked about whether or not they were able to wear a hat, and then we also talked about shade and access to water. And those are some of the conversations we had, and recognizing we had to be careful how we navigated those spaces, because we were actually on site where the workers were placed at. So if we ran afoul of the farmer, we could have been kicked out of the facility. But the partners that the mobile clinic had partnered with, they were the farmers were very understanding, and actually invited the mobile clinic to come every year to provide those services to the community, because they recognized that the need was there. And then that's where that key piece came in for the education side. And then for the evaluation piece and the needs assessment, that came a little bit later, when another location that was a little farther away reached out to the mobile clinic asking if there was capacity to host a new clinic location. But we had no idea or no information about this site. So I assembled a small team of other public health students, and we went out there and we created a needs assessment to do an interview with the coordinator as well as some of the community members to learn about the community, to learn about the resources, and also did a site visit so we could see where could we host this clinic if we had a clinic here. And from there, we then also designed evaluation forms that would be given to the patients and clients who'd come see us, to get an assessment from them what they thought of the clinic and what are things that they would like in the future and what they wouldn't want in the future. And that helped inform the evaluation side of the public health work that we did.
I love that. Going from seeing that there was a need and then asking if there was something that you could do, to being told, hey, yeah, you can expand this work and do more public health things here, to then having communities reach out, and then you assembling a team of public health people or public health students and going out there and doing a needs assessment, which are all very fundamental things in public health, and you're getting very hands-on experience from just interacting with migrant farm workers and the other stakeholders that are there. That is really awesome to hear. I know earlier on you mentioned that you were working with sex workers, and really knowing that they're a population that many times is unseen and their voices aren't really heard. What kind of tips do you have, as well as, I guess, migrant farm workers, what kind of tips do you have to people out there that are trying to do more community engagement work, trying to work with communities that are many times they're very marginalized and not part of broader conversations?
I mean, they're considered the invisible community, right? The voiceless community, because they're essentially in the shadows despite what they are doing. And how many of them are doing the work, that's not necessarily by choice either. And it's like being able to recognize when you're going to build or establish a program, you can't just create a program and expect it to be successful. I mean, for the work that I did with the sex workers, it was because I was working with a nonprofit that already has established a somewhat of a presence within these communities. The sex workers that we worked with specifically at that time were Asian Pacific Islander sex workers, but we went a lot to Koreatown, that was in part of Los Angeles, and we would go to spas and other locations where we suspected that there were sex work going on. At the same time, like we had to kind of meet them where they felt comfortable. I remember one of the first places we visited, like I went in there not by myself. We never go by ourselves. You'd always go with somebody else to sort of guide. And because I was new, I went with one of the paid staff who went in there, and I had a bag of condoms in one hand, a bunch of flyers in the other, different languages. And we walk in there, and first thing I noticed right away is like it was gated. And there was a older lady who came running at us, not to scare us or anything, but just came running right away. And then like when we started talking, the next thing we see is like someone was sleeping and behind her, like on a bed, and so she kind of shooed her away. And then she asked my coworker and I, "Oh, how can we help you?" And I was like, "Oh, we are just letting you know we're here from this agency. We are distributing both condoms, information about safe sex, as well as where you could get tested." And at first, the person who was later identified as a madam response was, "Oh, we don't do those things here. We don't need that." But then, like after we talked a few more minutes, they just accepted it and thanked us, and that was it. But that was like one of the first interactions I remember going into those spaces. There was another one I remember sometime after that. It was a bunch of women who were all wearing like, it was made up to be like it was a professional spa, but they're all wearing white doctor's coats. And when they came up to us, and when we talked about safe sex and condoms and things like that, they accepted them. And we just talked more about coming to some of our community events and sending, or if they wanted to get tested, they probably just were discreet about it. So it's like within those spaces, we have to meet them where they're willing to meet with us. And so for us, it was just having those ongoing conversations, having them recognize our face so they know that we're not there to report them, we're there to provide resources for them. And then for the migrant farm workers, because we already had that relationship through the farmers that allowed us to go in there, what made that unique was just like being able to have those honest conversations with the farm workers. And like when we did our clinics, that's when we had some general conversations. But then when I did my master's thesis, we went outside of clinic hours. I was able to work with the nurse that worked, who was I don't remember if they were from the community, but they spoke Spanish and were familiar with working with farm workers. And so because they knew her, they were willing to allow me to come there and interview them. And so it's about building those connections and making them actually real relationships versus a transactional relationship. And that I feel like has been very helpful for me in terms of recognizing that I'm just not there to just take data, collect data. They're not a number. They actually have a name, they have a story, they have a face, and humanizing people. And I think having that mindset versus going in there for just pulling data for money or for research, if you could just recognize that people are people, that would definitely help in terms of how you build those connections.
Absolutely. And considering that historically, a lot of research has been very extractive, just understanding that like trust is the fundamental thing, and like meaningful relationships and just showing up are important things that you have to do when you're engaging with these types of communities. So after your master's, you got your Juris Doctor in law at Willamette University College of Law. So tell us about that thought process. Was it that continuation of you wanting to do work around immigration law?
It was actually when I first started at Willamette University, it was to go into immigration law. or family law, a combination of family law and immigration law. But one thing I also realized too is that the connections I built in Iowa, it was harder to establish a farm worker relationship here in Oregon. And I had reached out to a legal clinic that was about 30 minutes away from where I lived. And I started like building connections to talk about what can I do within the community. But I realized I need to get my law degree before I could do anything else, because legally I can't do anything. But then when I was in law school, that's when I realized too, I needed to be out in the community. And that's where I applied, like I mentioned, for the Human Rights Commission with the city. But also around that time too, actually within the first year of law school, I got involved with a nonprofit, the Micronesian Islander Community. And I didn't just start with the nonprofit. I actually used to have a radio show. And just to add that on there, right? There was a community radio station here in Salem, and they were at the time looking for new DJs. And I used to do radio at the University of Iowa, because the University of Iowa had a radio on site for students. And so I wanted to continue that, but now in the community. And so I had a radio show. And what I loved about that opportunity was that it allowed me to connect with people who had different shows on the radio, but also my show specifically was on Asian Pacific Islanders. And so I would play either music, or my goal was to actually bring in guests and community members into the into the studio and do interviews. And when I was trying to type up, like, what are some Micronesian related or Pacific Islander activities happening, then Micronesian Islander Community came up. And it was actually around the time where they were getting ready to have their annual Taste of Micronesia. And so I reached out to the chair at the time, who was really excited to be part of the radio station. And I ended up interviewing one of the elders instead, who talked about the community, who talked about how they came here to Oregon and where exactly many of the people were from. And they invited me to their event, and I had a table booth specifically for the radio show. From there, they invited me to one of their board meetings. And at the very first day on the board meeting, the first thing they asked me was, we need a secretary. Do you want to be the secretary? And so I officially became their secretary somehow without even wanting to be a secretary. And so I did that for about a year. And then their chair had to step down due to health reasons. And I ended up getting boosted up to the chair position. And I served as chair / unofficially as executive director. And when I first started, it was 100% volunteer run, no budget organization. In the past 3 years, since I now formally have the title of executive director, we now have 8 paid staff, still an active working board, and our budget is about $2 million a year.
Wow. That's amazing. And I'll get back to that a little bit later on in the journey, but that is very much appreciated. And I think that's awesome that you were able to just show up, and then they were like, hey, we need a secretary, and then from there just building into executive director, which is awesome to see, as well as the organizational growth, and I could imagine the impact that y'all are having for the Micronesian community. So appreciate that work. So going back to your JD, or going during your time during your JD, you had a couple experiences that I will mention, and then you can talk a little bit about them. So you were extern at the Oregon Commission on Black Affairs, Governor's Office, Oregon Department of Education. You were an extern and volunteer at the Marion County Legal Council, and then you were an extern in Operations and Policy Analyst 1 at Oregon Department of Health. Can you talk a little bit about those experiences?
Yeah, so I think my first externship was actually through the Oregon Commission on Black Affairs. And at that time, I was tasked to produce a report that talked about disparate punishment among Oregon's youth. And specifically, it was bringing together the prison, the school to prison pipeline. And that is both a legal public health issue, big ongoing public health issue, where the younger you are and the younger you get into the system, the more the likelihood of you going into prison. And what that report looked at was what were other states doing and how Oregon was doing, and what were recommendations that the state could do. And I was able to within that short time period, pulled together a report that I ended up giving to the next extern to continue the work. And unfortunately, I don't know whatever happened to the data other than it was reported to the state legislature at that time. And from there, I spent, I think it was about a year and a half with the Marion County hearings office, actually. So I worked specifically with a hearings officer to learn more about like when a lot of her cases had to deal actually with dogs, dogs and traffic and tolls that might have come from the county. So it was somewhat public healthish, but more on the legal side, because we're talking more about, is this dog a dangerous dog? And what were the steps to pursue if the dog was identified as a dangerous dog? And from there, when I was at the Oregon Department of Education, I spent a year there looking at, from what I remember at this point, absenteeism was a big one. And so from there, I had to work with Department of Ed, but also trying to get in touch with the Oregon Health Authority or the state health agencies that are responsible for health-related work, and trying to pull data specifically. Where are we seeing a large number of students being absent? And this was pre-COVID. And like, what were like their circumstances if we were able to pull that data? And what kind of steps can we pursue to address this? So that was one of the projects I worked on. Another project I remember working on had to do with, at that time, there was a Native American Indigenous Student Success Act. I don't think that had passed yet, but it was more along the lines of collecting information that came from Indigenous communities throughout the state of Oregon and compiling it and seeing if we would be able to make it available in an organized fashion so that other schools and other communities would be able to utilize these stories and the information so that we could learn about the history of the land that we're occupying.
Well, thank you for sharing that. A lot of different experiences that you were able to gain there, both I feel like on the public health and the law side, which I think were probably very helpful in shaping a lot of the experiences that you've had. And after your JD degree, you got a few different fellowships that you were in. So perhaps you can talk a little bit about these as well. So you're a summer research fellow at the Oregon Climate, a Hartfield resident fellow at Oregon Department of Transportation in the Division of Transportation Safety.
So for the climate fellowship, that one was more of a remote fellowship opportunity, but it was just sharing resources and information about climate justice related work and what people in Oregon could do to address climate related things, whether it was like saving, making sure that if someone was going to cut down a tree, is it a tree that could be saved? So it was like different kind of things I was trying to do locally, but also on the broader national level. And then for the other position that was with the Department of Transportation, for that specific work, that one was actually supposed to be a closer connection between Department of Transportation and the Oregon Health Authority. And what I was looking at was a combination of safe walk to school, especially in communities where there might not be sidewalks, how people, like especially if it's young children, might have to walk a mile or more just to be able to walk to school because they're outside of the bus pickup zone. But then when you're talking about kindergartners who might be like 5 years old, 6 years old, who might have to walk a mile or more, especially in the late fall, winter months where the sun might not even be rising yet by the time they're walking, and then it already sets by the time they walk home. There was a lot of things relating to like safety, especially for youth. There was also, in addition to that, more pedestrian safety. At that time, there was a big push for drivers to recognize, like, you have to pay attention to the road. It doesn't matter who is crossing the street. And what I remember about that specific activity was that they showed like different images of who could be crossing the street. And one of them was a Bigfoot or a Sasquatch, like was a big picture of Sasquatch saying, even if it's Sasquatch, you still need to pay attention and let them cross the street.
Okay, very, very important stuff as well. And then taking you back, I guess, or maybe this was at the same time, you said that you didn't pass the bar. And what was that thought process there? And did you want to pursue it more? Or did you just find that it wasn't the path that you needed to achieve the things that you wanted to do?
It costs a lot to prep for the bar. Even though you are supposed to be learning this stuff in law school, you end up not learning the things that you need to learn. And then it's like you have to self-teach yourself to prepare for the bar. And at that time, I was no longer a single mom. My first 2.5 years of law school as a single parent. But then I had 2 children at that time, and I actually was pregnant with my third, but no one knew that. And but the hardest thing about the bar is you have to do the bar prep unless you are dedicated to it 100%. But I had 2 kids. There was no way I could not work. I had to work. So I was working and then trying to study a little bit in the evenings. But the reality was I couldn't, because it's like I'm home from work. I need to focus on my kids. Then when they go to bed, I might try to study a little bit, but I knew it wasn't enough. And I ended up not being able to take it. And it was very frustrating to recognize that, here I have this law degree, but I can't even use it because I haven't passed the bar. And while Oregon now is, especially since COVID, when they recognized that there was that significant public health concern about who would get sick with COVID, that year they passed something similar to what Wisconsin has, where as long as you have a law degree from one of the ABA recognized and approved law schools within the state, you automatically would get your license. And so for that year, they provided that for law students who graduated from any of the 3 law schools in Oregon. And because there's also a significant number of people who graduate from law school who have significant debt, but then for whatever reasons can't pass the bar, this adds a disservice for the number of people that we could provide support and services to. And the Oregon State Bar was working in collaboration to move forward with having the same program available, where they would be able to have people who have a law degree just be able to then move forward and still still be able to practice. But now they're trying to incorporate like an apprenticeship opportunity for those who have a law degree, where then they would be placed under the supervision of an attorney. I'm not sure of how long, but then once you do that, that would be equivalent to you would you put together your portfolio that would showcase that you're eligible to practice law. But I don't know if that will only be for people who just recently graduate versus people who might have graduated from a few years ago.
Yeah, if they're going to grandfather that program,
Yeah.
if that, and I know some people don't like that word grandfather, but yeah, do we get the point across there? But thank you for the vulnerability and just being transparent about that, because I know it is a very hard undertaking, not only law school, but taking the bar and just realizing that there are so many barriers, whether that is the education or just life, and how those things kind of like play into your journey, but definitely don't stop you. So another experience that you've had is you were a writer in residence at MSJD or Miss JD, I'm guessing. So tell us about that experience and how you got involved in that.
No, I don't remember how I got involved with it. I think it was, what I do remember was an opportunity for people who were accepted for 1 year to write monthly blogs, and it was on any law-related topics. And so my blog was specifically centered on experiences of being a single parent going through law school, as well as being a survivor of domestic violence. So it was like I sort of had a combination of talking about what the law experience was like, what it's like to be raising a young child while in law school, and what it was like having to go through the court system twice during law school as well, and trying to figure out how am I going to pay for a lawyer and not like go into debt trying to do that.
Wow. I can imagine that. And if that's available, please definitely share that so I can put it in the show notes so that if people are interested, they can check that out as well. Because I can imagine those challenges and just lifting that up, because I know many times we think that we're the only ones going through situations, but being able to write and share stories, I think, are very important so people could relate and just realize that there is progress that can be made, and there are more things in life and things that are going to be coming for you. So I appreciate you sharing that.
Of course, thank you.
And feel free to ignore this, but feel free to ignore this question, but if you do want to answer it, feel free to answer it. On the domestic violence side of things, what type of advice do you have for people that are going through domestic violence situations?
You know,
We could ignore it if you'd like.
Yeah, that's okay. My biggest thing is, if someone is telling you, believe them. Because it's hard enough for people to disclose that you are going through violence, and to be told that it's all in your head, or you need to stay with them because of XYZ. That's not helpful. It's harmful, and it makes it more likely for those individuals who are suffering from violence, and to close up even more and continue to not only experience hurt for themselves, but if they end up having a family together, their entire family could be hurt too. The other thing I could say to survivors is that, it's you have your good days, but then you also have your equally bad days. And while it's been 10 years since the last time it happened to me, like, I still have to co-parent, so there's still ongoing conflicts that take place. But I've learned over the past 10 years, like, ways where I could protect myself while also showing to our child that I'm not willing to put up with this anymore, and to serve as that model of, this is what a healthy relationship looks like, and this is what a unhealthy relationship looks like, and making that clear distinction of how all the things that happened had nothing to do with them. It was between their dad and I, and that when it comes to violence related work, it's hard work. There are days, like I said, where it's hard, and other days where it's not. And it's okay to get therapy. It's okay to get counseling, and to know that you're not alone, and that there are other people who are there to support you and who will believe in you.
Well, thank you for sharing that and being vulnerable around that as well. And I'm sorry that had to be a situation, but thank you for just continuing to be an advocate and doing your work to move forward. And appreciate that about how other people should approach talking, and just being very mindful of how they are speaking to people that might be going through situations like that. Because as you said, isolation is never something that's going to be helpful in that. And you just really want to be sure that you are supporting them and really being mindful in the ways that you're using. You were a project manager at the Asian Pacific American Network of Oregon. So tell us about that experience.
So I'm trying to remember how I first got involved with the abbreviation is APANO. And when I first got involved, I think I was actually I was invited to one of their community events. They used to have like legislative day around every February, I think on President's Day, where they would just pack the room with Asian and Pacific Islanders to then meet with state elected officials on specific policies or bills that were going through legislature. And that was also another taste of politics that I got involved in. And from there, like, then opportunity arose where through my nonprofit that I currently run, MIC, Micronesian Islander Community, we were offered funding from the county, one of the local public health counties, to hire a community health worker who was from the Micronesian community to work specifically in prenatal health. At the time, we weren't 100% 501c3 yet, and we needed to have a fiscal sponsor to be able to handle the funding for us. And so that's where I got involved with APANO, and initially started serving as a program coordinator / manager, specifically from that program. And then from there, we got additional funding. There was some state funding we received once that came from the Oregon Department of Consumer and Business Services, where we were able to provide enrollment into a state-funded program that would pay for the health insurance premiums of Micronesians who were citizens from the Compact of Free Association, or COFA citizens. And what that did was provide affordable health insurance for Micronesian COFA Islanders who weren't eligible for Medicaid, but who met the income requirements, but for their immigration status, even though they were actually supposed to have it. That's an interesting twist there in terms of what happened there.
That's good information to know. And I think there are like a lot of things that you listed up there, like being a fiscal agent and working as program coordinator, getting county funding as well as getting state funding. And I do want to ask a question around that state funding, because I think it's something that a lot of nonprofits kind of look forward to or try to get funding from the state, because it usually is a lot more sustainable most of the time in getting those funding and like just reaching that stage of like knowing that your organization is on a stage where the state is actually looking at you and seeing that you're an organization can provide services to support communities, specific communities, broad communities. So tell us more about how that came up for you all as an organization.
Well, with that funding source, what was unique about it was that the program was specific to community needs for a community that we already were providing service to. And because the state didn't have those connections, we were brought in as a community-based organization to bring in staff who spoke the language, who knew the culture, who knew the community, who would have easier access to get into those spaces versus a state agency who had no connection to the community, trying to march in there and say, oh, here's this program, sign up for it, but not have any language or cultural understanding. So that was like a very, again, public health centered approach, because we're going into the community because we are part of the community versus I'm just going to go in there and do whatever I want. And I would say like the experience was challenging at times, because when you're applying for state funding, even if it's like a small grant or a super large grant, it's a lot of work that you have to put forward into those grants. Even like the writing of the grant, and like when you're doing the budget breakdown, that having to justify all the little bits to it, but then also being told no. Like, so for example, in a lot of the work I do with the Micronesian, Pacific Islander, and even in the Asian communities, one thing that brings us together is food. And so I put in the budget, we need to have, like, even if it's to go hot plates or some little gesture of appreciation to bring people in. And the state initially said, no, we don't have the money for that. It's like, well, you're not going to have people sit in line for a few hours at a time, and if you don't have at least water or some sort of breakfast, dessert, or something for them to snack on. And it took a little bit, but I was able to get some funding for like 1 year, but then after that they denied it. So I had to be creative with coming up with funding from other sources to be able to provide those food. And then I also realized, we just can't have this enrollment event for people to sign up for healthcare. We need to have other resources, like what is the people's why to coming to this? So that's where it became evident that we had to partner with either, like, say, a vision clinic to provide vision screenings, or a dental clinic to provide dental clinics or dental cleanings, or even like a health fair where we would have like multiple agencies there providing different resources, whether it was women and infants and children's WIC program, whether it was SNAP benefits, whether it was, is there other people in the household who are eligible for Medicaid? Can we have that person here enrolling people into Medicaid? And adding those extra support and services really brought more people in when they saw that it wasn't just, oh, I need to come here just to do one thing and you're not going to provide anything else, to actually making it feel like it was more community centered and more had a community approach to it, essentially.
Well, thank you for doing that, because I think many state governments are very restrictive in how they're using funds. And like, to your point, this was like fundamental to getting the community there. And you had to advocate for that on behalf of the community. And even though it only worked out for 1 year, the importance of that and what that impacted, and using other funding streams to really support that type of work is important, as well as understanding that state government grants come with a lot of stipulations. The grant in itself is very long, the budget is very long, and then going through and doing the reporting requirements is also something that you have to think about as you get those large amounts of funding.
Oh yes, the monthly reporting was fairly interesting too. And then even having to justify when we did translations where the cost was coming from, because like there's some languages where like one word in English could mean a whole sentence in another language. And when it came to several of the different Micronesian languages, we're talking about Chuukese, we're talking about Marshallese, there's no English or no one word equivalent in the language to equal that same word in English. So they've had to define or spell out what this one word meant. And I remember this one sentence ended up looking like a paragraph. And I got asked, why is it one paragraph versus I just gave you one sentence? And then when I was able to have my staff explain the breakdown of what we were saying, they're like, well, that's not what we were trying to say. It's like, well, that is what you have to say, because if you just use this other word, the community is not going to understand it. And so we're trying to break it down to make it more tailored to what they could understand versus your extreme technological terms and legalese terms, when you have to make it more like 6th grade, 7th grade, maybe even 5th grade language for the community to understand what you're trying to convey.
Very, very important. And I think going back to your point of having like the state wanting to engage with the Micronesian community and understanding that the government has not been the most trusted to just come into communities, especially communities that are not white, put that out there. So and just really brokeraging your organization to make those connections, because you already have those relationships, and seeing how you can do the work. And I think we have to continue to push counties, states, and federal government to really get more community-based approaches in their grant funding and how they're doing work, so that you all are able, and other groups similar to yours are able to be flexible and work around and do the work that is important to impact the health and the life of these communities.
Agreed. I mean, when you look at some of the grant applications too, especially when it comes from state or even from the federal government, like some of the information that's expected or they're asking for, you might have it at your community-based organization because that's not something you collect. Or, for example, one thing they wanted to have was like 3 years of experience in this one area, but you just started, or maybe you're in your first year of this work. So therefore, because you don't have those 3 years of experience, you're not eligible for it. How do you address those disparities and discrepancies that take place when you got community-based organizations who are doing the on-the-ground work, often for little pay, but then facing these barriers to getting funding to provide the outreach and support to their community that need it most?
Yeah, little to no funding, as well as many times having executive directors that are volunteer based, and just understanding how that is a capacity limiter in the work that they can do. So yeah, I think there are many limitations and barriers that we need to work to overcome and become more community centric, so that we can really impact the communities.
Agreed.
So you were city council person at the city of Salem. So serving as a city council member in Salem, you've been on the front lines of local governance. How does your public health perspective inform your approach to addressing the needs of your constituents?
When I was on city council, one of the things that thank you, 3 of my years on council was during COVID. So let me just put that straight. That was one of the hardest things. My first year, I had the opportunity to get to know the community, like show myself, like knock on their doors, go to community events. And then from there, it was pretty much just virtual, or if we were in public spaces, like following the public health guidelines in terms of wearing a mask, staying about 6 feet apart. But then like it also hampered me quite a bit in being able to continue to build those community connections. But like one of my big things when I ran for city council, and that's one thing that I kept with me, is like I was centered on the neighborhood, community centered. And for me being a mom raising kids and also being a caregiver to elders in my household, like I bring in that unique perspective of being in the kind of sandwich generation where I've got my kids, I also got elders I got to take care of, as well as work at the same time, because the work as a city councilor, at least in the city of Salem, it's volunteer based. It's supposed to be part-time, but to be honest with you, sometimes it really felt like it was full-time, especially when it came to budgets, when it came to certain crises that took place. And you get people from all walks of life who contact you either by phone, by email, and all the different questions they ask. Some they might have questions in terms of what I do about a tree that looks like it's going to fall, or there's a sidewalk in front of my house that needs to be repaired. Who needs to repair that? Or there's a pothole on the street, and I'm worried that my car tire will burst. And then you also have people who ask more along the lines of where are the police officers when you need them, or why do we have to make police officers? You got mix of different perspectives that come into play. So I would say like one of the things that, if anything, that being on city council and also having that public health background was I centered my arguments around equity as well as advocacy. And I asked those data specific questions. Like, for example, in most cities, I'm sure, has this particular program where if you're paying for your city's water, sometimes you can't pay your water on time. So there's like a specific fund that's available for people to help pay for their water bill, whether it's like a month or 2 months, so it doesn't get shut off. And every few months, the director would come and report back with, oh, so many people applied for this program, and this is what we've been able to approve, but we need to get the information out more to people that there's this program available, because it still continues to be underutilized. So there still continues to be enough money in there where unless people are using it more, they're not going to add additional funding. If anything, they might start removing it. But long story short, what ended up happening was that every single year when I was on council, I would ask, and by the way, I never got the question answered by the time I finished council, but every year I would ask them, okay, so you have this many people applying. Can you show me the breakdown of who is applying? Is it like our elders? Like, is it specific demographics or maybe certain areas within the city that are applying? And the director told me at the time, oh, we don't collect that information. It's like, well, how do you then determine who is eligible and who is not? We need that demographic information, not because we're tallying on them, but it's because we need to see where are we having these pockets. Is it only English-speaking families that are applying? Well, what about Spanish-speaking families? What about Micronesian families? What about Russian families? And when we're looking at, for example, the Salem Kaiser School District, there's top five languages here in the city. And are we providing those services for those same communities? So it was Spanish, it was Marshallese, Chuukese, Russian, and Vietnamese, I think, was the fifth one. But not having that data, it doesn't really tell us then who are we missing when it comes to providing these services to.
And that's why I think it's so important to have data, and why people have intentionally, historically, not collected data, because then they don't have to answer to anyone. They're all the needs of the community is just what they are seeing, as opposed to actual tangible data, which I think is important. And I'll put a pin in that, because you also have a lot of data that isn't collected about these communities that are in the niches, because no one is giving them that voice, as we kind of mentioned earlier on. But a huge part of the work, and I hope that more city council people are able to use this kind of public health lens, because I think when we think about public health, it has so much, the skill sets that it has so much power to make like real impactful and positive changes. So I think that's really important to highlight. And on that note, many people listening to this, they might want to become a city council person in the future. What advice do you have for them in like running and getting through in that process?
Start talking to people. If there was somebody who perhaps ran for city council before and maybe they didn't win, or maybe they retired from city council, or even who is on city council, for example, or any elected office, many of them do want to hear from you and meet with you, whether it's in person, virtual, phone call. And depending on their capacity, some might be willing to mentor you. And so for me, like, I like to say that my win was a sleeper win, because when I ran for city council, I ended up applying, I think, a week before the deadline. And some positions, you just have to pay a fee in lieu of getting signatures. I needed to have a minimum of, was it 25 or 50 signatures, I think, to be able to, but they had to be signatures of voters who are eligible to vote in my ward. And so depending on what kind of city council you have, it could be a ward that you represent. It could be like a specific region. but in this the city, it's a ward. So I was in Ward 4, and there's a total of 8 different wards. So I had to get the signatures of people who were registered to vote in my ward, and I ended up with my small team, got I think about almost 100 and a little over 100 signatures just in case. So you always want to get more signatures than necessary, because you never know if how many of those signatures might end up being from people who didn't realize they weren't registered to vote, or they hadn't updated their registration to where they had moved to. So that was the first step. And then the next step is getting comfortable with being uncomfortable, asking for money, because when you run for office, you need money. And it's not just for the lawn signs, because those are somewhat of a waste of money. Majority of your money should be going towards combination of media, as well as whether it's social media, but also flyers that you would be mailing and or distributing to people, or even paying staff who would be, or volunteers, like a small stipend, who would be there with you, knocking on doors, getting your message out there. And then from March all the way till May, I was constantly knocking on doors, and I was a very small team. Like I was running up against a incumbent that he didn't really take me seriously, and didn't think that I had a chance, which was fine. They can think anything they want. And then even like some groups I actually thought would have been like in support of me, they actually decided not to show their support, instead saying they have to focus on these other seats, and they have nothing against the other person, but they don't see how I could add a different perspective to council. And let me add too, before I joined council, that there was only white city councilors, and it was at that time, I believe, still male dominated. So it would have been a big shift, because I would have been the first non-white voice in, I think, years who'd served on council. And it was just pretty much me. And sometimes I'd just be by myself, or sometimes I'd walk with one of my kids knocking on doors, just handing out flyers and leaving notes, and doing some social media posts and inviting people to come and knock on doors with me. And even I remember on the day before the polls were closed, like I was still making phone calls into the evening I stopped my last phone call around 8:00, reminding people, don't forget, if you haven't voted yet, here's your final chance to do so. And I went to one of the parties that they show, like, see who was ahead. And I remember right at 8:00, like waiting for the numbers to update. And at 8:30 or so, mine got updated, and it showed that I was at 50-something%. My opponent was at 47-46%, and it just stayed about 50%. And to me, that showed that you can make a difference even when you don't think you can, or when other people don't think you can, and that you can still win. It's just you have to add extra hard work and be very strategic in how you do things. I mean, I couldn't do this on my own. I had a campaign manager who volunteered for free. That's unheard of. But he had ran actually against the incumbent, so he had prior experience in terms of what he did, that what he would have liked to have done different. So having that extra perspective, somebody who's done it before, helped hone in my message, helped hone in on my fundraising strategies, as well as who we knocked on and how we knocked on people's doors and when we talked to people. And again, this was in 2018 when I ran, and then I won. And then I was sworn in 2019. And for that 1 year in 2019, I was talking to people, went to community events, and everything got shut down, obviously, because of COVID starting in 2020. So then it went 100% virtual. But then if somebody needed me, I'd either meet with them outside, or we'd have phone calls or video calls. So it did change how I wanted to engage with people, but I still kept that promise of community engagement in a way that was safe for me, but also safe for them.
That was fascinating. Shout out to you and your team for making that run and getting that work done. And I think definitely is inspiration for someone that might be out there thinking about trying to make like positive change in their community. Just know that you can do it. Just have to start, and you never know where you get from there.
I mean, let me add this too, that when I never thought I would actually go into politics. So it was a big, huge shift to go into politics, because growing up, politics wasn't something that my family and I ever talked about. And the only one time that I asked about politics, I had to be older than like 10. And it was presidential elections at that time. And I just remember it was Reagan versus I don't remember who. And I remember I asked my folks, like, who did they vote for? Did they vote for Reagan or the other person? And the only response that my parents gave me was, oh, we don't share that information. I was like, well, why? And the response was, well, because we don't talk about politics in this house. It's not something you openly talk about. So it's interesting to now have that mind shift. I'm not afraid to talk about politics. And I talk about it a lot with my family. Sometimes my parents aren't really there because they don't still kind of on the other end. But then like I talk about with my kids, I talk about with my partner, I talk about with the community who's willing to engage in politics questions because, you know, there's certain circles where when you talk about politics, it's like, how do you tread carefully within those spaces? But then also don't let it compromise who you are as a person.
Absolutely. And yeah, I'm glad that you highlighted that because I feel like that is very common, like just being in households where we don't talk about politics, and that can have detrimental effects, especially on communities that are not advocating and are not part of the political process. Because regardless if you're engaging in it, someone isn't engaging in it, and if you don't engage in it, then they will have all the say in all the things that happen in your community. So it's very, very important to talk about it, and I hope that we're able to continue these conversations and have more representation in these types of positions, because I think it's so important to have varied voices in the decisions that happen, especially when we're dealing with diverse communities.
Definitely. I mean, we need to see more of that representation too. I mean, because if there's no representation, whether it's on the city council or at the county or even at the state or even federally, like what does that showcase? I mean, I like to think that if anything, my time on council might inspire future generations who now have somebody who either relates to them or looks like them in that role, and knowing that they could have that role too.
Yeah, so important representation. Okay, so you are currently the executive director at the Micronesian Islander Community. As you stated earlier, you started as a secretary, then you moved into a board chair position, then you moved into the executive director position, first at volunteer, and now as a full-time staff member, I think it is.
Yes.
As well as you said that the organization has had extreme growth in the last 3 or so years, with like paid staff members, etc. So firstly, what do you do as executive director of the Micronesian Islander Community?
I like to say it as a jack of all trades. I mean, I do the budgeting, the forecasting, identify grants, apply for grants, whether we get them or not. I also oversee my staff, and that involves making sure like they get the necessary training, that we have our community outreach events, and that when it comes to reporting our data, that they're reporting it accurately and correctly. We do a lot of outreach events, especially now, even during COVID. On a monthly basis, we used to offer like food boxes, COVID vaccine clinics, as well as COVID testing. And over time, we've now shifted to still providing COVID vaccines, occasionally flu shots and other vaccines instead, but we still provide food boxes at some of our outreach events. But we also now hold different workshops. So, for example, we focus on 3 different core areas for our portfolio. We have health, and health is very broad. It could be chronic diseases. It could be like diabetes, cancer specifically, also STIs and chronic like diseases too, like diabetes, not diabetes, I already said diabetes, but also heart disease and physical fitness, all these other key things when you're not thinking necessarily that it's public health related. Like we've even had a workshop that's centered on car seat safety for families that utilize a car seat in terms of how do you buckle in your child correctly and make sure it's a safe thing to do. In addition to health, our other 2 core areas is housing. Housing, at the time, we did have a lot of money that provided short-term housing for people who were facing evictions. And now we sort of had to shift that viewpoint to less of the providing funding and more referral based to other agencies that have funding. But we're also working on renters' rights workshops in collaboration with other partners. And we recently bought property back in March to build affordable housing, as well as the first Micronesian cultural center here in the mainland of the U.S., because there's one in Hawaii, but otherwise there's none other anywhere else in the U.S. And that's the second portfolio. And then the third piece, last but not least, is workforce development and early education. So early education is like pre-K. And then when we're talking about workforce development, it's exposing and providing training for members of the community to have a licensure or certification to pursue either a career or a second career. And the two areas that we focus on are community health workers and healthcare interpreters for our workforce development work.
Definitely have a lot going on there, and very, very important bodies of work there. And firstly, like, shouts out to you all for having the first mainland USA Micronesian Community Center. That is dope, and I think that is important because we needed places to meet, and people need to feel like they have a safe place to be. And many of those times, it is at community centers that are designated for certain communities. So I'm really glad that you're all able to do that, as well as all the other great work that you all have been doing. So talking about the expansive work of like growing the nonprofit, whether that's getting new staff, getting more funding, how did you all go about getting that expansion and funding? Was it a goal to get it, or did it just kind of come up as the needs came up and you all were the right organization to get funding, or was it very strategic? How did you all?
To be honest, when we separated from our fiscal sponsor officially on March 1st of 2020, right when everything shut down. That wasn't planned. It just happened to be the day that we selected. Then COVID took over and changed everything. So a lot of the funding that we were able to secure was like trying to identify funding sources that we could apply for to get for our community. And at that time, we only had 2 staff, but we service total of 9 different communities, and they all speak different languages. And granted, we don't have community members from each community that we serve, but we recognized we needed at least 2 or 3 different staff. And so it was a matter of like applying for funding, a lot of funding, public health funding specifically, some that came from the state, some from foundations, some from other government agencies like the city or the county, and even the federal government had some limited funding that was available. We applied for all those different resources, trying to get the funding to do this work. And when we were able to have enough funding, I realized, we could just have more than just 2 staff. We could have like 4 or 5. And when we had the most amount of funding to do COVID work, especially recognizing the need in the community, we actually, I think, had closer to 11 staff. Then because of the shift in funding and resources, and also because some of my staff found full-time permanent jobs in other areas, like it made sense for them to move on. And that's one thing that I try to send that message as executive director of MIC, is like, if this is going to be your first job or if it's going to be your last job, I hope you make the most out of this position, and to recognize that you should be thinking about where you see yourself 5 years from now, where you see your projected growth 10 years from now. If you want to work for the state, wonderful. How can we help you reach that goal to work towards the state?
Great insights. And what advice do you have for executive directors out there?
Find your balance. Get the self-care that you need, because you do a lot of work. But also, if you cannot practice self-care for yourself, you're not practicing self-care and showcasing that to your staff, because some of your staff will be looking at you for those things. And if you want your organization to grow, you need to make sure your staff is thriving. And the only way that you can ensure that they're thriving is to check in on them. Like, don't just be hiding in your office thinking you just do the numbers. Go to community events. Help out at the community events. Be present in those spaces, because that's the only way that you will be able to reconnect with community and continue to build those connections. Because you could be a name without a face, and you don't want to be that, especially in very active and growing community-based nonprofit.
I love that. Modeling, I think, is important, not only as an executive director, but I think in life. So it's very, very key. So quickly, you're an assistant professor at Linfield University. what do you do there? Why did you want to become an assistant professor?
So I've been teaching at Linfield since 2011. And when I was finishing up my PhD, I realized I still want to teach, but I didn't know in what capacity. And then the opportunity to teach at Linfield came about, and I applied. And I went through the interview process and was offered the position. So I teach public health students at Linfield University. And I'm the first public health professor in the university to teach public health classes. The program was established in 2019, then I was hired in 2021. And so I teach about I teach 5 classes a year, and it's future public health students I am teaching, students who are either interested in public health or just need that as an elective. But my goal is to inspire these students to continue with a career in public health and to be the next public health leaders, because we need more public health professionals and public health workers out there. And what better way to do that than sharing my experiences, getting them connected to the connections I built and resources so that they could become and be prepared to be the next public health person. They could become the next ED. They could end up becoming and replacing me one day as the assistant professor of public health at Linfield University.
Yeah, I appreciate that. And you also shared that you are going into a PhD program in public health / global health. Tell us about that thought process.
I'm almost done, finally.
Oh, you're almost
I'm
done.
almost done.
Okay. Well, tell us about that thought process of getting into there and almost being done.
Yeah, so when I first started the program, when I first started the program was fall of 2018. And during my first term, I ended up, I was pregnant at the time, and I had my 4th child. And so then after that did 1 year, and then COVID took over. We went 100% virtual for felt like almost a year and a half. And there's some classes are in person, some that are still hybridish. It just depends on the formatting. And I'm now in my dissertation phase. I'm working on my dissertation proposal, and with the goal of defending and finishing it by fall of 2024. And I'm just ready to be done, is how I'll just put it.
Yeah. Well, we look forward to seeing you complete it, and good luck with the rest of your dissertation and the write-up.
Thank you.
You're welcome. So before I move you on to the Furious 5, where can people connect with you?
They could connect with me on social media. I'm active on Facebook and on Instagram. I have 2 different socials. I have one that was my former campaign one. If you're following me for my campaign or my previous city council work, it's Jackie for Salem, and then the number 1, so 1 after Jackie for Salem. And then the other one, if you want to follow my work from Linfield or more public health stuff, again, I'm on Instagram and on Facebook. It's Prof, P-R-O-F, Jackie Leung.
Awesome. Thank you for sharing that. And I'll be sure to link those in the show notes for anyone that's interested in reaching out or connecting with you.
Thank you.
So moving you on to the Furious 5, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Have fun with it. Like, get those experiences. Like, it's not always in the classroom. I mean, especially now since, COVID is still ongoing, and that's a fact. But if there's ways for you to get your hands out there in community work, get hands-on experience, that's going to definitely help you. Being in the classroom only provides so much input, and especially when you're applying for jobs later on, it's going to make a difference. Apply for internships, ideally paid, or if they're not paid, then try and find if there's funding sources, whether it's at the university or from another resource that would pay you for your internship.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Oh gosh, I don't know how to answer that question. I would definitely say, for my parents, they graduated high school, but I didn't have any mentors at the college level. So find mentors first and foremost, different career paths, have those informational interviews, and recognize that your pathway to public health, there's no central line to it. You're going to run into pivots. You're going to run into circles, or maybe you'll run briefly into a wall, but then you'll kind of avoid it, and recognize that there's no one singular path. whether you want to end up as an executive director, or maybe you want to end up in running a government agency, or maybe you'll end up working as a caseworker, or you end up teaching in academia. I mean, there's so many different fields that you could go into. You could go into academia, you could go into nonprofit, you could go into government, you could even go into private sector. And sometimes you have to try them all, and maybe you'll like one more than the other, and then you'll find your passion from there. But just know that you do have time, and don't be afraid to try it.
Love it. So number 3, what's something you're working on improving in your life right now?
Being able to say no, like recognizing that as much as I want to do something, I can't say yes to everything because it's going to be harmful for me, and also not enable me to practice the work-life balance that I'm trying to instill not only on my family, but also my students and also my staff. And just recognizing that I can't be everything and do everything. And it's okay to either delegate or just say I don't have capacity and not feel guilty about it. That's the biggest one. Not feeling guilty.
Love it, love it. Saying no, it means you're saying yes to the things that are more important to you.
Yes.
So very, very. So number 4, professionally, do you recommend anything?
You can always keep learning. There's no such thing as you've learned everything. And things that you think you're the best at, you could always look to see if there's ways to improve. Like I've been doing a lot of grant writing, for example, but I know I'm not the greatest at it. And so I identified some grant writing classes that allow me to not only practice doing grant writing, but also submit drafts for feedback. So that's like something that's personal to me when it comes to professional development. It could be like taking a class, and the class might be something data related, or it could be about a brand new public health topic that you're not familiar with. And there's a lot of different programs. You could do some of the free ones on EDX, or some of the low cost, almost free ones on Canvas, or one of those other programs that you normally have to pay a small fee for. But be willing to learn and expand your knowledge, because you're going to need to keep knowing and keeping up to date with these things. Just don't rely on Google for it all the time.
or ChatGPT.
Oh yeah, that too.
Number 5, if there was one piece of advice you'd give to your younger self, what would that be?
My younger self. I think my younger self would probably say the same thing to me about what my older self would tell my younger self. Slow down. I was always on the run, always on the go, wanting to go everywhere. I think I had a major case of fear of missing out. So major case of FOMO. And so if I could say anything, is take that moment and just breathe. And everything doesn't revolve super fast around you. It may feel like it, but it's okay to take it one moment at a time. It's okay to smell that rose. It's okay to just sit and be at peace.
Love that. Love that. Thank you so much for sharing that. And thank you so much for coming on, Jackie, and sharing your story and your insights. We wish you the best in completing your PhD program and all your endeavors going forward.
Thank you so much for allowing me to be on here and for chatting with everybody.
Yeah, truly is my pleasure. And I know your story is going to be so helpful and inspirational to many out there. So thank you once again. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to subscribe, leave a like, leave a review, and share it with a friend. That's the best way to get the show to more people and just really share these stories and information with anyone out there. So subscribe, like, review, and share with a friend. Appreciate you all. Peace.